So hope you all are busy with your regular routines and studies. So yes, I'm expecting all of you to join in this live session. So here again, came back with an extraordinary live. So this webinar is again useful to all of you. So in this webinar, again, we are going to discuss regarding the medical surgical nursing. How this medical surgical nursing is being important in your 4 years of nursing course, and how much importance is there in even in your career. So we'll discuss more points when we are going into the live webinar. So I'm expecting more students to join the session. So hope you all are doing well. Yes. So you all are active. You all are ready. So how far you are interested, please do comment. So this is a Prakara live platform. So where you will get knowledge regarding the nursing courses, that too in a simplified, easy manner, and you can grab maximum marks. So that is how this platform is an excellent platform for all the nursing students. So I suggest you to recommend for your friends as well, to your known people, those who are studying nursing. And so coming to this session, so I'm just again waiting few more minutes to get engaged, so that even other people can join the session. So how about you all? Very recently we have started with the semester system, right? Hope this students, those who are starting with the semester system, may have little difficulties in getting adjusting. But still we have a very good output from the semester systems, because all the subjects have been minimized to each sem, and you don't need to struggle more to clear the subjects. So very few subjects are being given in every semester. So that is easy for everyone to clear that in that first semester and even second semester, and you can learn in a better way. So hope this SEM system will also be comfortable for you all. And how about your preparations for your exams? Hope it is going well. Again, this is the best tool for you to go through once and just get back to your lessons and have your memory-based assessments. So that will also be helpful for you to grab good marks. Yes, yes, I'm expecting again. So good evening, one and all. Hi, everybody. How are you all? Yes, I'm good. I hope you are also doing good. Yes. Yes, that is very nice. Very nice. So I'm expecting many more students to join the session so that we can have a better understanding of this medical surgical nursing, and you will be benefited out of it. Yes. So I hope I'm audible, and I hope my screen is visible. Yes. Yeah. So very good. So as we were been discussing, so this is just introduction to your knowledge and to make you to understand how this medical surgical nursing is important, and what were the various units that have been mentioned in your subject, and how you have to allot time period, or you can say the weightage of unit. So how much importance to be given for that unit, and how you can score better marks, and how to appear in the examination. All these questions will be cleared in this session. So we are going to discuss in detail regarding the each chapter contents as well as the frequently asked questions. And you will be able to understand after the session, you can have a clear picture that what you should study in medical surgical nursing and how to study in medical surgical nursing. Hope you are okay with the session. So let us get into the session. Coming to the first list of units. So what contents? So what is there in the medical surgical nursing? So if you take the list of units, the first unit we have introduction. So introduction is completely related with introducing you to the medical surgical, because this is again a special subject where you will not have any understanding, where you will not be seen in your earlier years. So this is introduction. In the chapter, you're going to get introduced to the subject. And then next, second unit, we have common signs and symptoms and management of it. So what were the common signs and symptoms that we encounter? So this includes all the signs and symptoms from like it is not systematic. It is like all the signs and symptoms from head to toe. It includes the cardiovascular, it includes the renal, it includes the hepatic, all the signs. Okay, it includes every signs and system and how to manage it at the basic level, like first aid management. And then the third unit covers the nursing management of patients with respiratory problems. So this chapter from here, you will be starting to understand what is this med-surg actually meant for. So here you will be dealing with the respiratory disorders, all kind of respiratory disorders and how you are going to manage that. And then the fourth unit comprises of digestive tract and digestive system related issues and disorders. So here in this chapter, you're going to deal the digestive tract. So from where the digestive system starts and how you're going to deal, like each part of your digestion will have one or the other issue. So what we call it as and how we are going to manage. And then the next unit covers the patient with blood and cardiovascular problems. Again, this is a very major unit whereby it is dealing with the blood disorders as well as the cardiovascular disorders of adults. Again, you should remember that we are dealing adults. Okay. And then the next unit, it covers the nursing management of a patient with genitourinary problems. Genitourinary problems includes the problems related with your bladder, problems related with your kidneys, ureters, nephrons. All these problems are being included in this genitourinary system. And then the last unit, it covers the nursing management of disorders of male, including reproductive system. So the elderly, as I said, we are dealing with adults. So elderly reproductive system related issues will be dealt in our seventh unit. And then the next unit is eighth unit. So which is going to deal with nursing management of a patient with disorders of endocrine system. So your endocrinology consists of your pituitary gland and then hypothalamus, adrenal gland, you have thyroid, you have parathyroid. So all these glands, you have gonads, all these glands, we have the disorders. So what happens when the gland have such kind of disorder? All such disorders will be discussed in this 8th unit. And coming to the 9th unit, you have nursing management of a patient with the disorders of integumentary system. So what integumentary system comprises of and what were the disorders that the skin can have? And then the next will be nursing management of a patient with musculoskeletal problems. So all the problems related to the muscles as well as related to the skeletal system will be discussed under this unit. And coming to the 11th unit, so it deals with the nursing management of a patient with immunological problems. So what immunological problems do they have? So immunity, if it is good, it is fine. When there is immunosuppression, when they are unable to fight against the infection, what happens to their body and what were the different kinds of immunological related disorders, all these will be discussed in this unit. And coming to the 12th unit, we have nursing management of a patient with communicable diseases. We have different kinds of communicable diseases. So not one, we have different diseases. So what were those different diseases and how to manage all these will be dealt in this unit. And coming to the 13th unit, we have perioperative nursing. What is this perioperative nursing? So it includes before the surgery, before the operation and even after the surgery. So it includes the components of pre-operative as well as the post-operative as well as the intraoperative. So being a nurse, what kind of procedures, what kind of care that you need to give before the surgery, even during and after the surgery. So all these topics will be included in this 13th unit. Hope you're able to understand what I'm telling and hope my voice is audible to you all. Yes, good. And coming to that, weightage units. So what is this weightage units? Weightage units are nothing but these units are being given a higher priority when they are prioritized, when they are writing your question papers. Even these units are being considered as more important to be learned by a student now, because this is very important when you are going to take care of a patient. That doesn't mean the other units are not important. Even the other units are too important, but still this has been given a bit priority. Okay, so you can focus more on this units to grab your marks. The first one is third unit, which is the nursing management of patients with respiratory disorders. Okay, so respiratory system is a very important system, vital system, right? The respiratory disorders even carry the same weightage. The next weightage unit will be the patient nursing management of a patient with disorders of digestive system. So GI, so those who are having the digestive related problems, even that is again important. Even when you're caring for a patient, so if there is no proper digestion, proper respiration, what happens? So the person will not get adequate energy, right? So that is the reason even these units are being given highest priority. And then the next unit will be fifth unit. So where they are going to discuss the highest priority of this unit will be the blood and cardiovascular problems. Even this cardiovascular and blood related issues are being having highest priority. And then unit 6. So here we are going to discuss regarding the genitourinary problems. So even the GU, genitourinary related issues are also a high priority. And then disorders of endocrine system as well the disorders of musculoskeletal system. So all these units are being given a weightage units, are being considered as weightage units, which means you must focus on these units when you are studying for your exam, when you are appearing for your exam. So you should never miss these units. That is what we meant to. So you should include these units into your first timetable. So when you finish this only, you can go for the further units to complete your subject. Then only you can get good marks and you can be a better nurse after your completion of course. And let's start with the units. Okay, so the first unit that we are going to discuss, like what contents you have in this first unit will be your introduction. So as I said, this will be introducing you the medical surgical nursing. So what here we have mainly introduction to the medical surgical evolution. So you will be explaining. So in this unit, this will be explaining you the nursing evolution of medical surgical aspect. So how the nursing has been evolved medically as well as surgically. So it will give you a brief about the history of this evolution. And then it will also cover the review of concepts of health, illness, disease, and disease causations, classifications, international classification of diseases, ICD-10 classification. So we have this ICD-10 for every disease. So you should know what is this ICD and how it is being classifying the disease. Okay. So it will also give you an idea of this ICD classification. As well, it will give you an understanding of this health as well as disease concept. Okay. So you might be studying the same concept earlier even in the nursing, but still this will be a further refined way of understanding the relation between the health and disease, because in depth we are going to deal with the system in this subject. And it will also give you a concept of acute illness, chronic illness, and terminal illness, and stages of illness. So as I said, you might have an idea about the illness, but since you will not be able to understand the differences between acute, chronic, terminal, right? So this subject in this unit, especially, you will have an idea, you will get an idea, because it is also going to deal with this acute illness. When we consider it as acute, when we consider it as chronic, and what is this terminal illness, and what are the stages of illness. So by this way, you can have a clear picture of illness, like when we can consider it as ill. When can we say the person is ill? Such kind of clarity you will get when you go through this unit. It will also cover the review of concepts of comprehensive nursing care in medical surgical condition based on nursing procedures. So comprehensive care, that what you're going to do in the hospital based on the medical conditions on nursing procedures. As I said, we have different systems and different conditions. So based on each condition, what kind of care a nurse should do. So such basic care will also be given introduction in this chapter. And again, you will have a role of nurse, patient and family in care of adult patient. So what is the role of nurse? You will be studying this role of nurse in every way, right? So when you finish fundamentals of nursing, you will study it. When you come to medical surgical nursing, you will study it. But still, there is a difference. Here, you're going to study what is the role of nurse in taking care of a patient along with their family. See, there is a different role. A nurse will play any number of roles, but still, you must know how to deal with adult patient, how to deal with aged patient, how to deal with a pediatric patient. Right? There is a difference between dealing of patients. Every person will not be same, right? So that is the reason here they have been explaining you the role and importance of a nurse in taking care of a patient along with their family, because here we are going to discuss the major disorders, the disorders related with cardiovascular, respiratory. All these were serious conditions, right? So during such conditions patient may get hospitalized for so many days. So how to deal with such patients and how to deal with such kind of families, it is very important, right? So that is the reason even that has been an important aspect in this first unit. And coming to the other aspects which they covered in this unit will be the roles and responsibilities of a nurse in medical surgical, outpatient department, inpatient department, intensive care therapies and community settings. Like being a medical surgical nurse, so we have different settings, right? OBs, inpatient departments, community settings. So how to deal with different people in different settings. So that is also included. And then next we have introduction to the medical surgical asepsis. Asepsis is nothing but free from infection, right? So how to do medical asepsis and how to do surgical asepsis. This is again a very, very important aspect related to your practice. When you go to the hospital, you must know this medical asepsis and surgical asepsis. Before you enter into any ward, you must do that. Before performing any procedure, you must do it. When you are being there in an OT, you must be doing the surgical asepsis, right? So such important is this medical and surgical asepsis. In this, we will be explaining you the procedures, how you should do this asepsis technique, and what were the different PPE that is available in hospital setting, and how to how to use it, how to put on, how to remove. All those techniques will be taught in this part. And apart from that, the inflammation, infection, immunity, and healing. So, what is this process of inflammation? So, when you will have inflammation in your body, when you have any injury to the body, right? So, why this inflammation happens? Again, there is a physiology behind it. So, all that physiology will be taught to you, and how infection will enter into your body, how it will spread your body, how your immunity system will fight against it. So all that physiology will be taught, and even you will be learning about wound healing. So if a person had any wound, if it is a minor or major, how the healing proceeds. So it has different stages. So initially, if you have a wound, so how much time it will take to get clotted, and later on how much time it will take to have a better healing, new tissue arising. All these will be learned in this unit. And then care of surgical patient, pre-operative, intraoperative, as well post-operative. So what kind of care that you need to give pre-operatively before the operation, before the surgery, and what kind of patient, what kind of care you are going to give during the surgery and after the surgery. So these were the topics that we are going to cover in our first unit, that is introduction. Hope you are clear with that. Yes. And then coming to the most frequently asked questions. So every students wish to know this, right? Because if it is most frequently asked, they'll be very happy to know it. They will be studying it. They'll be ready to read only these questions. For your idea, we'll have a most frequently asked questions here. And coming to the essays from this chapter, we have a first essay, that is define illness and disease, and then the next question. So you have essay. I hope you can understand this A, B, and C, because we have difference in their marks. Okay. So in the first question, we have a component A, which is only the definition of illness and disease. So you need to define what is illness and what is disease. Enlist different classification of disease. So as I said, acute, chronic, terminal, right? We have different classifications of this. And describe the causes of disease. So when you will get disease. So we have different causes: environmental causes, biological causes, pathological causes. So all these causes must be defined clearly. And coming to the other question, then next, the other question will be define wound. Define wound. So what is meant by wound and when you consider it as wound? And then next B part, you have endless different types of wound. So what were the different types of wound that you have? And C, write down the nursing management of a wound. So being a nurse, what kind of care that you will give for a patient who is having wound? Okay, so that is what the essays that frequently asked from this particular chapter. And coming to the short notes, we have write a short notes on medical and surgical asepsis. As I said, this medical and surgical asepsis is very, very important to the practical aspect as well as to the theory aspect. So you must know this surgical and medical asepsis. And coming to the very short answers, define anesthesia. So what is anesthesia? When you are going to give anesthesia, what are the common sites of anesthesia? So you must be knowing all these questions, right? Okay, you should learn all the answers for that. And what is inflammation? So inflammation, so at what stage of wound healing you can see this inflammation? So you can write that. So that's all with this first unit, which is introduction. So we have seen the components of this unit and we have even seen frequently asked questions. So hope you understand. Hope I'm clear. Okay. Yes, good. So we are moving to the another unit, which is second unit. The most common signs and symptoms and the management. So as I said, so we have, so common signs and symptoms that we are having in this medical surgical conditions. So it has the fluid and electrolyte imbalance, the first common manifestation. So if there is any abnormality with the cardiovascular system, if there is abnormality with the renal system, if there is abnormality with the fluid intake, food intake, so all this can lead to fluid and electrolyte imbalance. So what were the electrolytes that usually we have? We have sodium, potassium, chloride, all different electrolytes we have, right? So we are going to deal what were those titrations. So either it may exceed or it may be deficit. So it either if it is exceed, we say it as hyper. If it is the deficit, we say it as hypo. So you might be learning. So you might be learning this condition: hyperkalemia, hypokalemia, hypernatremia, hyponatremia, dehydration. So all these were common manifestations. These are not conditions. Okay, they are manifestations because of associated disease inside your body. Okay, as because your heart is not working properly or your kidney is not working properly, which is evident in the form of this kind of manifestation. Here in this chapter, you're going to learn how to deal with such kind of manifestations. So if a patient had hyperkalemia or if a patient had dehydration, what immediate measures that you need to take? What were the classical signs of such imbalances and how frequently You have to assess their vitals. How far you can make the patient to reassure, make them to come to normal stage. And when you have to take the patient to the hospital, all these points you should discuss in this common signs and symptoms. Like that is first, fluid and electrolyte imbalance. And then next, coming to the vomiting, you all might be known about this vomiting. It is also a very common manifestation, especially with the GI tract and if they had any side effects of the drug. And then coming to the another common manifestation, which is dyspnea and cough, respiratory obstruction. It's very clear if they had any respiratory disturbances, any respiratory related disorders, that will be manifested in the form of dyspnea and cough. And respiratory obstruction. Respiratory obstruction will be manifested as difficulty in breathing. That is what dyspnea means, right? So dyspnea as well cough, when they have difficulty, when they have fluid accumulation, obviously patient presents with cough, right? So this is also another condition, like another manifestation that we assess, that we learn in this unit. And then we have fever. So fever is a classical sign for infection, right? So we all know this. Then how to manage the fever. So what were the signs and symptoms that you need to notice when a patient is having fever? Those things you will learn. And then coming to the other common manifestation or other common thing, shock. So shock is also a manifestation because of undergoing disease progress. So it can be different types. We have different types of shocks, like cardiogenic shock, neurogenic shock, hypovolemic shock, septic shock. Different types of shocks are there. So we don't know what kind of shock the patient might have. So here you will be learning these different kinds of shocks and how to manage it. And then coming to the other one, unconsciousness and syndrome. So what is this unconsciousness? Sudden loss of consciousness. And what is this syndrome? And how to manage the condition? How to identify the difference? What is the difference between unconsciousness and the syndrome? So those things you will be learning. And then you will also learn about pain. So pain is also a fifth vital sign that you must learn, right? Because pain, no person can tolerate it. Either it is a mild pain or a severe pain. Pain must be managed. So that is the reason it should be learned by you. And then next we have incontinence. Incontinence is also a problem related to your renal system, where the person will not have ability to control their voiding, right? So this kind of conditions, like this kind of manifestations must be treated at the earlier, and it should be noticed. So when the person is having serious conditions related to the nervous system or a muscular system or renal system, then only you can manifest with incontinence. So such kind of relations and such kind of conditions will also be learned. And coming to the other common manifestation, edema. Edema is nothing but the fluid filled in the body. So what is this edema? What are the different kinds of edema that we have? And when you can say it as spitting and when you can say it as non-spitting, all these you will be studying. And the other one, age-related problems, especially in the geriatrics. So once we are aged, once we have age, once age is getting increased, so your bodily systems will not function properly. Why? Because of increased age, even your body will be increasing. It will also get tired with you. So that age-related diseases are there. What are those age-related diseases? We are going to see in this second unit. So hope you are okay with the contents of the second unit. Hope you understand it. Yes. Moving forward to the frequently asked questions. So frequently asked questions, coming to the essays. The first question will be define pain. So what is pain? What enlists different types of pain and describe physiology of pain. So what are the different types of pain that we have? We have different types. So you might be thinking, what are the different types? So please, when you are studying, you have different types of pain and even physiology. Physiology is also there. So how pain starts and how the brain receives the impulse and how you will perceive it. So all those things you need to write in this essay. And coming to the second question that you have is define shock. So what is shock? And coming to the another part that you have endless different types of shock and their clinical manifestations. So as I said, we are having different types of shocks. So what are those different types and what are their clinical manifestations? And then next we have write down the medical and nursing management of shock. So here they are asking only the medical management of shock and nursing management of shock. And coming to the short notes, so short notes will be only one question that frequently asked is short notes on unconsciousness. Like when you say it as unconscious and what kind of tools you use to assess conscious level and how you're going to manage a patient with unconscious. And coming to the very short answers, you have here defined Glasgow Coma Scale. As I said, it is a tool which is used to assess the level of consciousness. And then the next question that we have, what is edema? Okay. And then we have enlist the causes of dyspnea. So what are the different causes that a patient can have dyspnea? So these were very frequently asked questions. Hope you're clear with the second unit and the contents of second unit as well. Frequently asked questions from the second unit. I hope you all are okay with that live. Yes. Hope my voice is audible to everyone. Yeah. Okay. So coming to the third unit that you're going to deal here, the nursing management of patients with respiratory problems. Okay. Here we are going to deal with nursing management of a patient, including elderly. You are dealing with adult as well, including elderly with respiratory problems. So what you're going to learn in this unit? So in this unit, you're going to learn review of anatomy and physiology of respiratory system. Earlier in your first year, you might be studied about the respiratory system related anatomy. So what it includes? It includes the upper respiratory and lower respiratory, the nose, pharynx, and then the lungs, bronchioles, everything, right? So the coming to the physiology, what is the physiology of respiration? What is internal and external respiration? All this. So again, you're going to have a revision of it, okay? Because you can have a better understanding. And nursing assessment, history and physical examination. What kind of nursing assessment you should take here? Again, this is very, very important because nursing assessment is different for all kind of system. Like for respiratory, it is different. For cardiovascular, it is different. For GI, it is different. That is the reason every system you have this nursing assessment as a part of your learning. Okay. So what kind of assessment that you should do when a patient came with respiratory illness? Like what kind of sounds you need to hear? Like whether it is a rails or bronchi or normal sounds, vesicular sounds, you have different respiratory sounds, okay? What kinds of sounds you need to observe in a patient and what kind of history you need to ask. You may be having a doubt with that. Do I have difference in the history? Yes, of course we have difference. So you will be very particular and keen with relation with the respiratory system, okay? Only respiratory related history you should ask, like where they are living, what kind of environment, what kind of pollutants they may be having, do they have the habit of smoking or do they have any passive smokers nearby? All these questions will give you an idea what is their occupation, okay? So all these questions will give you an idea why they are having this disease, okay? That is the reason you must focus on this history. And physical assessment. So physical assessment. So what physical examination you will do? So you have to do the inspection, palpation, percussion, auscultation. So will be similar for every system, but still what you will observe in the inspection, what you will do in the palpation, what you will do in the percussion, and how you have to auscultate. All these are very, very important when you are doing the physical assessment pertaining to the respiratory system. Again, I am telling there is difference. So each system will have difference in it. That is the reason you have to learn for every system. And then you have here the etiology, pathophysiology, clinical manifestations, diagnosis, treatment modalities, medical, surgical, dietetics, and nursing management of adults, including elderly. So all these components will be similar for all the conditions that you're going to see now. The first one will be the upper respiratory tract infection. So upper respiratory. So upper respiratory is still your bronchus, right? From nose till your bronchus. So till the trachea divides into bronchi, we consider it as upper respiratory. So what kind of respiratory infections that we have? Rhinitis, sinusitis, laryngitis, pharyngitis, all these infections related to the upper respiratory, you're going to study here. And then next we have bronchitis. So bronchitis is nothing but your inflammation of bronchus. So which is coming to your lower respiratory tract. Okay. So how this bronchitis will affect your respiration, how it is going to damage your lungs, how it is going to disturb your physiology. Then next we have asthma. So what is this asthma? Very frequently we'll be listening the term asthma, and why we call it as asthma, you're going to study. Then next we have something called emphysema. Emphysema is also a respiratory condition whereby there will be a buildup of fluid. So this fluid buildup will have increased pressure. So all these things you will be learning. And then next we have something called emphysema. So there is a difference between emphysema and emphysema. So what kind of difference it is and how it is going to affect, that is also you will learn. And then next we have atelectasis. Atelectasis is nothing but collapse of your alveoli. So you all will be knowing this alveoli, right? So these are sac-like structures which are completely filled with your lungs, which are responsible for taking of air, right? So this alveoli will get collapsed, which means will not open at all. So why it is happening? Like what kind of measures you need to take? So such things you will be studying in this. And then coming to the other condition, that is COPD, chronic obstructive pulmonary disease. So what is this chronic obstructive pulmonary disease meant for, and what are the different conditions it includes? Okay, that is also you're going to study. And coming to the other condition, so bronchiectasis. So bronchiectasis is also a condition whereby you will have your bronchus will not elongate. Usually, when you take air, it should elongate, right? So here, bronchus will get strict. So it will have a strict structure because of the damages that it had undergone. Okay, why it is like that, and what management you should do, you'll study. And coming to the another common condition, pneumonia. So you all will be hearing the term pneumonia, right? It's nothing but infection of your lung. And then we have pulmonary tuberculosis. This is also a very common communicable disease. You will learn in this chapter. And lung abscess. So what is this lung abscess? Getting infection and repeated infection that will form an abscess in your lung tissue. Okay. And then pleural effusion. This is a procedure. Sorry, pleural effusion is also a condition whereby there is a fluid build up in the pleural space. Okay. Because of that also your lung space will get reduced and you will have difficulties breathing. And the other thing is cyst and tumor. So we have different tumors related to the lungs and different cysts. So chest injuries, and again we are going to learn about chest injuries like abrasions or any falls or any stabs. All these injuries you will learn. And respiratory arrest and insufficiency. So what is respiratory arrest, and when we consider it as respiratory arrest, we learn that. And pulmonary embolism. So what is this pulmonary embolism, and when you when you consider it as pulmonary embolism, and what were the special therapies that is very particular with this respiratory system, and what were the alternative therapies that we follow, and different procedures that we do in the hospital setting, and drugs used in the treatment of respiratory disorders. So all these were the components that include in your third unit, which is nursing management of a patient with respiratory problem. So hope you're clear with third unit. Yes. Yeah. Good. Good. So now we are moving into frequently asked questions from this unit. As I said, it is a weightage unit, right? So this is given higher weightage. And coming to the first essay that is frequently asked, define COPD, explain pathophysiology and clinical manifestations of COPD, prepare nursing care plan for a patient with COPD. And the second question, define bronchial asthma, different types of asthma, explain the pathophysiology and medical management. So here you need to define and you need to explain the types, as well you need to define the pathophysiology and medical management. So read the question carefully and answer accordingly. And coming to the short notes, so you need to write a short. The first question is write a short note on pulmonary embolism. Like what is pulmonary embolism, and you have to explain it. So what are the different causes that is leading to pulmonary embolism and how to manage it. And then next is pneumonia. Pneumonia, as I said, it is also a very common condition. So that will be also asked as short note. And very short answers. Enlist the risk factors of sinusitis. So what is sinusitis? What are the risk factors of sinusitis? And then we have defined epistaxis. Epistaxis is also a very common problem that we encounter. So it is nothing but nosebleed, right? So what is epistaxis? We have different types of epistaxis. So if you define that enough, you will get it. Hope you are clear with the frequently asked questions. Yes. Good. Hope my voice is audible to all. Okay. And now we are moving to the another unit that we have in this medical surgical, that is unit 4. Okay. So in this unit, we are going to discuss disorders related to digestive system. So what are the different disorders related to digestive system? So as I said, review of anatomy and physiology will be common for all the systems. So you need to focus on the anatomy and physiology for every system. And then nursing assessment, history and physical examination is also quite common. As I said, it is different for every system. And then next you're going to deal with the conditions, that is disorders of oral cavity. The oral cavity, what were all the different disorders, like disorders of lips, disorders of gums, disorders of tongue, disorders of salivary glands, as well as teeth. Okay, so all these different disorders will be dealt in this oral cavity. And then next, you will have something called peritonitis or acute abdomen. So what is this peritonitis? Peritoneum is a covering, right? So your abdomen will have a large covering called peritoneum. So that is getting inflamed here. That is getting infected here. That is why we call it as acute abdomen. So that is also a major condition that you will study here. And coming to the disorders related with the pancreas. Pancreatic inflammation, pancreatic cyst, abscess, and tumors related to the pancreas. And coming to the liver, you will also study the inflammation, cyst, abscess, cirrhosis of the liver, portal hypertension, hepatic failure, and tumors. So all these things you will be studying in the liver. And coming to gallbladder related obstruction, you know gallbladder, right? Gallbladder is also a small structure which is attached with the liver and which is responsible for producing gall juices and all. So very, very responsible for the digestion. So inflammation, obstruction, and stones and tumors in the gallbladder will also be studying. And apart from that, you will be studying special therapies and alternative therapies and nursing procedures pertaining to gastrointestinal system, and as well the drugs used in the treatment of digestive system. So that's all with the 4th unit. So especially we are going to discuss related with the digestive system disorders. You're clear with the contents, I hope. Good. And now we are moving to the frequently asked questions. Okay. So very frequently asked questions will be the cirrhosis of liver. So what is cirrhosis? What are the different causes and clinical manifestations? And write a nursing care plan on a patient admitted with cirrhosis of liver. So this care plan includes care of a patient that you're going to do in the hospital. Like what kind of care that you're going to do. So this includes the assessment part, diagnosis part, and planning part. Like what measures you should take to prevent future complications. So you should write those things. And coming to the another question that we have intestinal obstruction causes and pathophysiology of intestinal obstruction, and then post-operative nursing care for intestinal obstruction surgery. So clearly read the question. Okay, they are asking only post-operative care. After the surgery, what kind of care that you should provide. So that you should explain. And coming to the short notes, you have GERD in detail gas. And then you have a short notes on peptic ulcer. So what's peptic ulcer and how you are going to deal with it. So if they ask even for short notes, you have to explain like definition, causes, symptoms, evaluation, diagnostic evaluation, and then management. So everything must be there, but in a short form. Okay, and then next you have appendicitis. Appendicitis is also a commonly asked question. And then very short answers, define anal fistula and what is intersusception. Okay, so these were the few common questions that we came across in your previous question papers. Hope you're clear with this fourth unit contents as well frequently asked questions. And then coming to the fifth unit that we have patients with blood and cardiovascular disorders or cardiovascular problems. So here we are going, again we have the same. We have review of anatomy and physiology as well the assessment, nursing assessment, the history and physical examination, and here also we have the same pattern. As I said, it is similar for all the systems. Every system will have its own anatomy and physiology, its own assessment part that you need to understand. Okay, and then here we are going to deal with the conditions related with cardiovascular system. So what are those conditions? Like hypertension. Yeah, very short terms we call it as BP, right? Blood pressure. Hypertension, hypotension. So what is this hypo? So less blood pressure. Hyper, more blood pressure. And then atherosclerosis. Atherosclerosis is nothing but the plaque formation. Lipid plaque formation in the blood vessel, which is leading to cardiac arrhythmia. And then we have something different diseases called the Raynaud's disease, aneurysm, peripheral vascular diseases. All these diseases are quite new for you all. So you will be learning all these diseases. Apart from that, you will also be going through this ischemic heart disease, coronary atherosclerosis, angina pectoris, myocardial infarction, valvular disorders, congenital and acquired rheumatic heart diseases. So these diseases are very particular with your cardiovascular system. So these diseases will give you a clear idea. So how different people will affect. So we might be thinking heart related only heart attacks, but it is not that in your practice. So you have different diseases related to your cardiovascular system. But when patient comes to your hospital, you will only manifest. The patient will have a manifestation of cardiac arrest. But the pathology behind it may be quite different, right? You will be learning all these conditions. And then also you will be learning infectious conditions like endocarditis, pericarditis, myocarditis, which means the heart valve. It could be a pericardium or myocardium or endocardium. If it is getting infected, how that is going to affect your cardiac functioning. And then next, cardiomyopathy. Cardiac muscle, how the muscle will also get different diseases. So even muscles will get disease, right? How if cardiac muscles are getting diseased. And then cardiac dysarrhythmias. Dysarrhythmias are nothing but different rhythms. So few people may have fast rhythm, you may be having abnormal rhythm. So how we need to deal with that. And heart block. Heart block is suddenly a part of heart muscle will not get blood supply. So how you're going to deal that. And congestive cardiac failure, so your heart failure. You will also be learning car pulmonale. What is the car pulmonale and what is the pulmonary edema, cardiogenic shock, cardiac tamponade. As I said, all these were newer terms for you and you will be learning in detail when you go through this chapter. And apart from all these things, they will also be included the cardiac emergencies as well as cardiac arrest. And they will also include, they have included the cardiopulmonary resuscitation in short form CPR routine. So what is the CPR and how we have to give? So if you see there is an image beside you all. So how CPR is being given and in emergencies, how we will do that. And you have blood related disorders like anemias, polycythemia, bleeding disorders and clotting defects, Platelet defects like thalassemia, leukemia, leukopenia, granulocytosis, lymphomas, myelomas, special therapies as well as blood transfusions. So all these are included in this chapter. You're going to learn in detail of every condition, like how it is going to affect and what is blood transfusion. Again, blood transfusion is an important procedure that you will be performing in the hospital setting. So what safety checks you should do, how to do the procedure, before procedure, what measures you should take, and what kind of checkings you should do after the procedure, what kind of measures you should take. So all these things you will be learning. And apart from that, you will also be learning management and counseling of blood donors. So it is blood someone should donate, right? Or else we will not get blood. And how to motivate others. So simply one person cannot come and donate blood. Maybe there are few who are willing to donate, but many people will not be willing, right? So you should know how to counsel them to donate their blood. You will also be learning phlebotomy procedures, post-donation management, and then blood bank functioning, hospital transfusion committees, biosafety, waste management related with the blood transfusion, and role of nurse in organ donation, retrieval, and banking. Organ donation is also a major aspect where we should give concern more, because nowadays organ donation is been getting its important, right? So once you die, no one is going to use your organs. But if you give, at least you can utilize it for the other people and you can safeguard others' life. So that has also been an important aspect in this chapter. And apart from that, you have alternative therapies, nursing procedures, and drugs used in blood and cardiovascular disorders. So that's all with this fifth unit that we have, cardiovascular and blood disorders. So if you see the frequently asked questions, we have myocardial infarction. The first question frequently asked will be MI, causes and risk factors of MI. Write down the medical and surgical and nursing management of MI. Explain in detail about congestive heart failure. So there is a quite difference between MI and CCF. So you will be learning it when you go through the chapter. A nursing care plan should be written for a patient with MI. And then second, short notes. The short notes frequently asked are anemia, rheumatic heart disease, and CPR procedure. As I said, CPR is quite important. And very short notes, expand ECG. So what is ECG? When we will use it? What is digoxin therapy? What are the common symptoms of aneurysm, and define cardiac arrest? So these were the common frequently asked questions from this chapter. Again, it is a weightage given chapter. So these were frequently asked. And coming to the another chapter, that is 6th unit, nursing management of a patient with genitourinary problems. So in this genitourinary problems, sorry. So again, we have the same review of history and review of anatomy and physiology, nursing assessment, as well the history and physical examination, which is, as I said, different for every system. And you will be learning about the conditions related with the kidneys. So urinary system, right? So kidneys. And you will be learning here nephritis, nephrotic syndrome, nephrosis, renal calculus, tumors, acute renal failure, chronic renal failure, end-stage renal disease, dialysis and renal transplant. So what is this dialysis? Dialysis is a very common procedure that we come across in the hospitals, right? So we have different types of dialysis, how to take care of a patient during dialysis. All those things you will be learning. And coming to the congenital disorders of the urinary tract system. So disorders of the urethra, urinary bladder, not only kidneys, we have different parts, right? So you'll be studying all those disorders, inflammations, infections, structures, strictures, obstructions, tumors, all these will be learning. And apart from that, we'll also have a special therapies, procedures, and then the drugs used in this system. So these were the things that you will be focusing in the genitourinary system. And coming to the frequently asked questions, so you have a scenario here. They will be giving you a scenario and asking you to write the condition. So if you take a first scenario, Mrs. Geetha, 30 years old, admitted with glomerulonephritis. Good enough, they have given the condition. And so here they are asking you to define the glomerulonephritis, causes of glomerulonephritis, and management of glomerulonephritis. And again, they are asking you to list down the complications of chronic glomerulonephritis. And then the second question you have a define benign prostate hypertrophy and list the clinical features of BPH. Describe the surgical management for BPH, post-operative nursing management with 3 nursing diagnoses. So what are the possible 3 nursing diagnoses that you can have in BPH? So all these things here they are asking you to explain. And coming to the short notes of this condition, so here they are asking you to explain the nursing management of client with urinary tract infection, so UTI, and then list down the types of renal caliculi and explain one type. So what are the different types of caliculi that we have, and only one type they are asking you to explain. And coming to the third question, they have cholelithiasis. So what is cholelithiasis and what are the measures that you need to take to prevent it and to treat it. And then next we have very short answers. Hydronephrosis. So what is about hydronephrosis? So that's all with your 6th unit, that is genitourinary problems. And then that we have 7th unit, nursing management of disorders with reproductive system, male reproductive system. So as well we have the anatomy and physiology of male reproductive system, history and physical assessment as I said. And then we have the conditions, congenital malformations like cryptorchidism, hypospadiasis and epispadiasis, infections related to the male genital tracts, testes and adjacent structures, penis and penis related infections, inflammations and hypertrophies, sexual dysfunction, infertility, contraception. So that's all with these male reproductive. And coming to the female, we have breast engorgement, gynecomastia, tumors, and special therapies and alternative therapies that we have in this system. And nursing procedures and drugs used in the treatment of disorders. So that's all with this male reproductive system related disorders. And frequently asked questions. So they have asked prostatectomy and different approaches and advantages of this prostatectomy. And then short notes. So they have asked about the hypospadiasis and epispadiasis, and write notes on vasectomy, like what is vasectomy, when they are going to do it, and what kind of care we need to take. And very short answers, we have gynecomastia, what is gynecomastia, and hydrocele. So what is hydrocele? And then next, coming to the 8th unit, we have nursing management of a patient with endocrinal disorders. So again here the review of anatomy and physiology are quite common, and nursing assessment and history and physical assessment are also quite common. And coming to the disorders related to the thyroid and parathyroid, diabetes mellitus, diabetes insipidus, adrenal tumors, pituitary disorders, special therapies, alternative therapies, nursing procedures, drugs used in treatment of disorders of endocrine. So as I said, endocrinal system will have different glands, right? Thyroid, parathyroid, adrenal. So each gland will have its own disorders. So we have to list down, we have to learn all those disorders, and then management of those disorders will be there. And accordingly you will take care of a patient. And coming to the frequently asked questions, diabetes mellitus was the most frequently asked question. Classification of DM, clinical features of DM, nursing management of a patient, especially they will be focusing on dietary management. And then coming to the short notes, thyrotoxic crisis or thyroid storm visit. Okay, that is also a condition. So you'll be learning it. And then we'll be, you have again one more short note, that is insulin therapy. And then we have nursing management of a client with hypoglycemia. So these 3 were the commonly asked short notes. Very short notes, goiter and then complications of thyroidectomy. If you remove thyroid gland, what were the complications? So hope you are clear with this unit. And coming to the another unit, we have a patient with integumentary system. So again, you will be doing the review, again, you will be doing the assessment, and you will be learning the conditions like infections, infestations, dermatitis, and then infectious and non-infectious dermatosis, acne vulgaris, which is very common terms, we say pimples, okay, allergies, eczema, psoriasis, malignant melanoma, alopecia. Alopecia is nothing but loss of hair, right? So all these conditions you will be learning in your integrated system. Apart from that, you will also have a look into special therapies, alternative therapies, nursing procedures, and drugs used in the system. And coming to the frequently asked questions, you have a skin graft definition, only short notes. Usually you will not get any stay from the unit. Short notes like skin graft, characteristics, signs and symptoms of psoriasis, and what is alopecia, explain about its significance. And coming to the very short notes, we have pyoderma and eczema. Okay. And then coming to the 10th unit, you have musculoskeletal system. So here you are going to discuss the diseases related with your muscles, ligaments and joints, inflammation, infections and trauma, and bone fractures, bone inflammations or bone infections, dislocations, tumors, and then osteolacia, osteoporosis, osteomyelitis, all these conditions you will discuss. Arthritis, congenital deformities, and again, very, very important that you are going to discuss here is spinal cord related deformities, which is very important. So vertebral disc prolapse or spinal cord injuries, how to manage a patient is very important. Okay, what is quad spine, all this you will learn. And what is Pagel's disease, what is amputation, prosthesis, transplants, replacements, rehabilitation. So which is very, very important, especially pertaining to this musculoskeletal system. And apart from that, you will also be having a look into special therapies, alternative therapies, nursing procedures, as well drugs used in musculoskeletal system. And coming to the frequently asked question, so very frequently we get fracture as well osteoporosis. So here they'll be asking you to write the predisposing factors and special management or specialized investigations, as well the fractures and types and causes, classifications and nursing management. And coming to the short notes, so osteomyelitis in detail and pathophysiology of osteoarthritis. And very short notes, so you will get the purposes of a traction. So what is traction? What are the different types of traction? What is the purpose of it? So very shortly, you can write only purpose. Okay? And define ossification. What is ossification? And what is quad spine? So these were very frequently asked questions from this unit. And then next we have disorders with the immunological problems. So here you will be studying about immune system, and then you will be knowing about immunodeficiency disorders, and then primary immune deficiency, phagocytic dysfunction, B cell and T cell deficiencies, secondary immunodeficiencies, acquired immunodeficiency syndrome. In terms we say AIDS. Okay. And then what were the transmission, how standard safety precautions you should follow, what is counseling, how to counsel the patient, and how to educate a patient, what kind of home care we need to give, what is NACO, what for it meant, what is it meant for. And again, we will be studying infection control program in this chapter. And rehabilitation, special therapies and alternative therapies, procedures are quite common like others. So frequently asked questions will be AIDS and its pathophysiology. And short notes, they'll be asking about primary immunodeficiency disorders. So what are the primary immunodeficiency disorders and warning signs of immunodeficiency disorders? And very short answers, types of immunity, define phagocytic dysfunction, types of plague and risk factors of influenza. And coming to the another unit, we have communicable diseases. So in this communicable diseases, you will be learning about the communicable disease like tuberculosis, diarrheal diseases, hepatitis A, hepatitis E, herpes simplex, chickenpox, smallpox, thyroid, meningitis, gas gangrene, leprosy, dengue, plague, malaria, diphtheria, pertussis, poliomyelitis, mumps, influenza, tetanus, yellow fever, filariasis. So you have a big list here. Okay, so you're going to learn about all these communicable diseases. So like what you're going to learn, the causes, the pathophysiology, the management, prevention, everything you will learn. And then reproductive tract infection, and then you will be learning a special infection control measures like notification, isolation, quarantining, immunization, infectious disease hospitals, how you will manage. So all those things you will learn in this chapter. And coming to the frequently asked questions, dengue was frequently asked. So what is the management? What are the signs and symptoms? All these things. And short notes like tuberculosis and then malaria. And very short answers, types of vaccines, gas gangrene and types of leprosy. And then coming to the last unit that we have perioperative nursing. So in this perioperative nursing, you will be focusing on the organization of a physical setup of OT, like how your operation theater will be there. What is the design of that OT? What are the staffing pattern like OT team, duties and responsibilities of a OT nurse, principles of health and operating role and instruments, attires, what were the sutures, what were the suture materials, equipment, OT tables, common surgical procedures, positionings, drapings, scrubbing procedures, gowning procedures, preparation of OT sets, monitoring of a patient during the surgical procedures. Completely related with the surgery, like how you need to understand, how you need to focus more on this topic. So if you go to the hospital, you have to learn all this. Okay, then only you can understand the surgery and then only you can cope up with the further surgical procedure. If you want to scrub, you should able to learn this basic skills. And apart from that, they will also be, it also includes maintenance of therapeutic environment in the OT, standard safety controls like infection control measures, fumigation, disinfection, sterilization, biomedical waste management, prevention of accidents and hazards, and anesthesia. So what are the types of anesthesia, methods of administration, effects and stages, equipments and drugs. Okay, and CPR again, which is a repeated topic, and pain management techniques and legal aspects. So these were the components. These were there in your perioperative nursing. And coming to the frequently asked questions, explain the role of a nurse in OT. Different types of regional anesthesia was the frequently asked essay. And coming to the short answers, infection control in OT and classification of anesthesia. And very short, surgical asepsis and medical asepsis and what is suture material. So that's all with that. And coming to the very important questions in all the subjects. So tuberculosis was a very, very important question. And then bronchiectasis and symptoms and pathophysiology and management. Peptic ulcer, duodenal and gastric ulcer was again a very important point of concern. Hypertension and enumerate the types of hypertension, medical management of hypertension. Cardiac catheterization was again an important question, like what were the possible complications of cardiac catheterization, preventive measures and care. And anemia, again an important concern. And then benign prostate hypertrophy, BPH we call it as. So that is also an important question. Nephrotic syndrome, which is also a very frequently asked question. And then thyroidectomy. What is thyroidectomy? What are the indications, complications of it? Immediate post-operative care, like immediately after the surgery, what you need to do. And then osteoporosis is again very, very important point of concern. So these all are frequently asked questions from this unit. And if you take the short answers, list down the complications of healing, types of inflammation, clinical manifestations of acidosis and alkalosis, fluid and electrolyte replacement, pulmonary function test. So what is pulmonary function test? Bronchiectasis. So in short, you can write bronchiectasis. And types of hiatal hernia, types of congestive heart failure, classification of hypertension, types of cardiomyopathy, types of leukemia and management, nursing management on blood transfusion, nursing management of a client with urinary tract infection, types of renal stones, describe the erectile dysfunction, management of client with hypoglycemia, and then clinical manifestations of diabetes insipidus, malignant melanoma, explain about bone marrow aspiration. So these were the frequently asked questions from all the units. And stages of fracture healing, types of spin tractions, T-cell deficiencies, chicken pox, clinical manifestations of HIV and AIDS, care of patients in operating room during the surgery. So here we have a model paper. Hope you all know this model, like how you're getting in your examination, but still you have a model paper here. So usually we'll be asking, you will have an examination for a maximum of 75 marks. And among this, the first section will be given for 30 marks. So 15 marks will be for each essay. So each question carries 15 marks. And then you have a short notes. So each question carries 5 marks here, and very short notes. You will have 10 questions. Each question carries 2 marks here. So hope you're clear with the pattern of this examination. So we have come to a conclusion of this presentation. So here I'm going to give you a valuable message. Please do listen it. So Prakara has been giving an excellent platform for you all to learn all these chapters. So you might be surprised and shockingly listening. So do we have these many chapters? Yes, of course you have. But still, we are going to launch this program, that is MLP, Minimum Learning Program. Here you need to give only, you need to pay only 149 rupees. So with 149 rupees payment, you can get the access to all videos that we have done in Prakara website. So we have an app and we have our online platform where we have launched all the necessary videos which is essential for the nursing students. Here you can access the video lectures, you can access the student notes, key terms, and then self-assessment tools. So this is only for 149, and this will be valid for 21 days. So you can have a trial pack. Please do have this trial pack. So this is a quite a minimal amount. So you may be using it for many purposes, but still have a trial of listening to the videos. So we have great experts. From great experts, they have been scrutinized to these videos, and they are presenting you in a very crisp and understanding way. So instead of going through your monotonous textbooks and monotonous lecture forms, you can better add this online platform which will give you an easy way of learning nursing. So you can even suggest your batchmates, you can refer your batchmates. Here you have another advantage. So do you believe that if you have any doubt in any of the class, if you have any doubts, you can reach us in the number which is given on the screen. Please take the number. So through WhatsApp, your doubts will be cleared by the experts. So you can listen all the videos. I am again telling, this 149 will give you a free access to all the videos. Anatomy and physiology, nutrition and biochemistry, and then fundamentals of nursing, medical surgical nursing, what not. So just take up this opportunity, grab this opportunity. Please do refer your friends and make them to utilize this opportunity, because you can learn the things in a better way. Once if you go through the video, you can understand what I am telling. So it is very simple and easy to understand the conditions, to learn the conditions. So please do refer, and you can clear, like as I said, the newer SEM systems. So even for the newer semester system, newer students can also opt this plan. You also have this semester plan. So they also launched this SEM 1 and SEM 2, applied biochemistry, applied nutrition. All these even been done by the experts. The experts, they have taken a class and they have explained you in a very clear and very crisp manner. So please go through those classes and make utilize of those classes, and hope you will be able to grab better marks and you will be able to learn better way. So this is again a beautiful platform. Please note down the number that which is given, that which is appearing on your screen. Please do share it, and you can have this is like unlimited number of listens. You can listen the video for many number of times. You can take notes from the lectures. So lecture notes will be there in the video, and so student notes, like from the video, maybe the presenter will be explaining different things, but you may not be able to take. So you don't even so you don't want to take that. Already we have given a student note, so you can easily write it, you can easily use it, you can study for your exams, and you have key terms. So we have many key terms. So because we may not be able to learn by self, right? So big textbooks are there for us, but still this is very difficult for us to go through and all, right? So this will be giving you an easy access through your mobiles, through your laptops. You can easily sit and study from wherever you are. So no need to take big books and all. You can just carry a mobile, use your headphones. You can listen the classes very peacefully. Repeatedly, you can listen the classes for your better understanding. Read the student notes again and again. Hope, don't you think that this will be a better opportunity if you take? Obviously. So please grab it. Please take the number. Please utilize this opportunity that which is provided with Prakara only to the nurses, and this will be again for only minimal days. So before this expires, please take this opportunity and utilize it for a better assess, for a better learning, and for your better scoring. So if you use it, if you take this opportunity, that will be very helpful. I recommend personally that you will not regret if you take this opportunity. So just a rupees of 149 will not be a matter. So if you want to have a better learning, if you want to do better in your studies, please do learn, please do subscribe, please do share it. So if you have known friends, please do recommend it, please do share it, please ask them to follow our platform Prakara. So hope you understand the session, what we had today. So happy learning, keep on practicing. Please follow Prakara for your better understanding. And thank you so much for your patience. Thank you all.